like you to understand that these are reasons why manufacturers manufacture drugs in different dosage form. Because the key to therapy or treatment is what? Letter C. I always say this. The key to therapy or treatment is compliance. Okay? Compliance. No matter how many prescriptions a doctor prescribes to the patient, if the patient doesn't go to the pharmacy, pick it up for whatever reason, there'll be no treatment happening. Okay? The bottom line, the key to treatment is compliance. So what are the reasons why patients don't go to the pharmacy? One, no insurance probably. Okay? Two, doesn't believe in what's prescribed to them, or I'd rather do homeopathic first before Western or synthetic medication. See? Okay. They have insurance, but they don't like Western medicine or synthetic. They'd rather go the homeopathic way first. So again, the key to treatment or therapy is compliance. Okay? Many times it's because a patient doesn't have insurance and cannot afford to pay the copay, cannot afford to pay for the drug cash. Okay? Any questions? Or the copay may be expensive. They may have insurance, but the copay is very expensive. Okay? Any other information that you'd like to add for composite?
The only other thing is that when doctors are prescribing this for children, they base it on weight, in that at first they're supposed to be taking like 2.5, 3 times a day, but the maximum is no more than 15 milligrams per day.
Correct. Okay, so like what you've learned in dosage calculation, most of the time we calculate the dose of the drug based on weight. But for children, it's weight and age. Okay. Another thing I'd like to point out, DEA class, it's not controlled. That's why Elizabeth just put in there, it's prescription. Okay. Prescription only, not over the counter, but it's not controlled. Okay. Any other additional information that you'd like to share for composite or a call? Yes. Stormy, was that you?
I'm good. I've done everything.
Okay. Okay, so next one would be Depakine. I have the PowerPoint to Depakine. You ready? Let me open it up. James said he is ready. James, are you getting the hang of the cycle?
Yeah.
Okay. You see, I try to make it more routinary, the schedule. I try to make it that way because I thrive on schedule and organization, and usually our jobs become more like a routine. Okay, it's sad to say, but it's like that. For the better though. Okay, let me try to share this PowerPoint for you. Ready? Can you see it?
Yeah.
Okay, perfect.
So I got Depakine. That's supposed to say the nervous system. I don't know why it says digestive.
Oh, my template. The template that I gave you, I think, says digestive system.
Oh, okay.
You might have forgotten to change that. Okay.
Yeah.
So it has to be nervous system, correct?
And then the generic name is valproic acid. And then the therapeutic class is an anticonvulsant. And then the pharmacologic class is an anti-manic agent. And then it's used to treat seizures, manic episodes associated with bipolar disorder. And then it's just the DEA class is an RX. And then I found on drugs.com, I think it was, that it was the pregnancy class was not assigned. But in Australia, as I said, I believe it was like pregnancy class C. And then some important info, liver problems have happened within 6 months of starting Depakine. It may cause severe defects if you take while pregnant. And then children under 2 years are greater at risk of deadly liver problems, and it may cause very bad and sometimes deadly pancreas problems, and may happen soon after use as well as many years after use. That's it.
Okay. So Depakine is the brand name. Generic is valproic acid. On your lecture packet, Shauna's going to be good at this one. She's going to tell you the page number. There's a Depakine, Depakote. Remember that? There are combinations, okay? And then last Friday, we discussed what? Seizures, convulsions, okay? The grand mal, the petit mal, the status epilepticus, all of the seizures, okay? So tie that into the depakine, like what Jane said. So when does this happen? This is used to treat seizures and manic episodes associated with bipolar disorder. Okay, so the system is not digestive, like what James said. It affects the nervous system. And the therapeutic class, remember the therapeutic class is the use of the drug in medical term. Okay, the therapeutic class is anticonvulsant. Anti means against, convulsant from convulsion, okay, used to treat seizures. James, what kind of seizure did you figure out? Anybody figure it out? I can see your fur, baby Elizabeth, trying to be part of the class, but very, very good. Not disturbing you.
Let me look through here. I don't seem to have it written down.
Okay, can anybody help? What type of seizure? Anybody?
I think I read it says it helps with the grand mal.
It helps with the grand mal. I'd like you to verify this one, okay? James, I'll get back to you on this one. Okay. I told you, Shauna's going to tell you what page. I'm checking the chat box now. Okay, Shauna said my topic on seizures is on page 10 of the lecture packet. The depakine is in there with a seizure section. Okay, thank you, Shauna. Shauna's very good at finding from the lecture packet so that you guys are guided. Okay, again, review for the finals happened last Friday. So Stormy, you missed that part. Maybe get in touch with somebody for that particular review for the lecture packet. Any additional information? It's not a narcotic. It's not classified by the DEA. Okay, it's not classified by the DEA. Okay, so it's not controlled. That's why James put RX only. But it's not over the counter as well, okay? Any questions on this one? Seizures, manic episodes associated with bipolar, okay? No questions, guys? Okay, I'll stop right here. Get ready, next one. Next one would be Dilantin. Who got Dilantin?
I have it.
Okay, Christine, are you able to share your screen and show your beautiful face?
I kept sneezing, so my face was not overly beautiful, right? That's why I hid my face.
Oh, okay. You ready? Perfect.
So the brand name is Dilantin and the generic name is phenytoin. It's an anticonvulsant. I don't know how to say that word. Dantoin derivative. It's a prescription. Pregnancy category is D. It's used to treat and prevent epilepsy, and it has very serious interactions with alcohol.
Christine, where's your, oh, you just put bullets?
Yeah.
Okay, so which one is brand, which one's generic?
The brand name is Dilantin and the generic is phenytoin.
Phenytoin, correct. This is another anticonvulsant, okay?